How do stroke patients regain speech and confidence? Recovering speech after a stroke is a journey that involves more than just exercises. It's about rebuilding the ability to communicate and feeling confident in expressing yourself again. When a stroke damages parts of the brain responsible for language, it can cause conditions like aphasia, which makes understanding or producing speech difficult. Some may also experience dysarthria, where controlling the muscles used for speech becomes a challenge. These changes can be frustrating and often lead to feelings of social isolation and lowered self-esteem. The good news is that recovery is possible through a combination of medical rehabilitation, targeted therapy, and emotional support. Speech and language therapy is the main treatment used to help regain communication skills. Licensed speech-language pathologists work closely with patients to develop personalized plans. These plans usually include two main approaches. One focuses on improving specific language skills like word retrieval, sentence formation, and pronunciation through structured exercises. The other emphasizes practical communication strategies, teaching patients how to express their needs in everyday situations, even if their speech remains limited. Research shows that consistent speech therapy can lead to meaningful improvements in speaking, reading, writing, and understanding language. More intensive therapy, involving more hours over a shorter period, often results in better progress, but it depends on the individual's health and stamina. Therapy exercises are designed to strengthen the muscles involved in speech, such as the tongue and lips, through activities like tongue movements or mouth shaping. Breathing exercises are also important because controlling breath supports clearer speech. Language drills, such as matching pictures to words or describing objects, help rebuild vocabulary and grammar. Practicing these skills in real-life situations, like reading medication labels or chatting about daily activities, helps make the improvements practical and relevant. Support from family and friends plays a vital role in recovery. Encouragement, patience, and understanding help motivate patients to keep practicing. Support groups and counseling can also provide emotional comfort during this challenging time. It's important to set realistic goals because recovery varies widely among individuals. Some may regain most of their speech, especially if therapy begins early and the stroke was mild. Others might find that some speech difficulties persist, and they may need to rely on alternative methods like writing, gestures, or speech-generating devices. While full recovery of speech may take months or even years, many patients experience significant improvements that boost their confidence and quality of life. Building confidence is closely tied to seeing progress. When patients notice they can say a new word or be understood by loved ones, their self-esteem naturally grows. Therapists often include activities that celebrate small victories and gradually increase in difficulty to help patients feel successful. Practical tips for patients and families include practicing speech exercises regularly, using technology like speech apps to supplement therapy, and staying socially active. Engaging in conversations, even with limited speech, helps rebuild confidence and keeps communication skills sharp. Always work with a licensed speech-language pathologist to ensure exercises are appropriate and effective for your specific needs. In summary, regaining speech and confidence after a stroke involves a mix of professional therapy, consistent practice, emotional support, and patience. While every person's recovery path is unique, most can achieve meaningful improvements in communication and regain a sense of independence. Remember, progress may be gradual, but with dedication and support, many stroke survivors find their voice again and rebuild their confidence to participate fully in life. Always consult healthcare professionals for advice tailored to your individual situation.